Good evening, everyone. My name is Simiran Choudhary, and I welcome you all on behalf of Voice of Healthcare to this important panel discussion, Lighted Red for Blood Cancer, supported by Pfizer. We all are gathered to shed light on a topic that affects countless lives but often goes unnoticed: blood cancer. With September being Blood Cancer Awareness Month, this is a timely opportunity to raise awareness, share insights, and discuss advances in the prevention, diagnosis, and treatment of this life threatening disease. And for this panel discussion, we are honored to have a distinguished panel of experts who will guide us through key insights on prevention, diagnosis, treatment options, and the future of blood cancer. Now, I would like to introduce all my panelists for this discussion. Dr. Nitin Gupta, Chairman and Head Clinical Hematology and BMT at Sir Ganga Ram Hospital, New Delhi. Welcome to our panel discussion, sir. Dr. Manoj Toshniwal, Consultant Hematologist at Jeevan Amrut Hematology Center, Aurangabad. Welcome to our show, sir. Dr. Vinay Kumar V. Bohara, Consultant Hematology and BMT Physician at CHL CBC Cancer Center, Indore. Welcome to our show, Dr. Vinay.
Thanks.
Dr. Rahul Rattan, Associate Consultant Clinical Hematology and Hemato-Oncology at Fortis Hospital, Mohali. Dr. Rahul will be joining us shortly for this panel discussion. Now, I would like to begin my panel discussion with my first question to Dr. Nitin Gupta. By understanding blood cancer, so can you explain what exactly is blood cancer and how it differs from other types of cancer? What are the major types of blood cancer that the general public should be aware of? Dr. Nitin?
I think some issue with the connectivity at his end.
Yes, I believe so. Dr. Vinay, it would be great if you can answer that for us.
Yes, can you repeat the question? I'm sorry, I missed it.
Sure, I do that. So, can you explain what exactly is blood cancer and how it differs from the other types of cancer? What are the major
Hello.
types of blood cancer?
I think
Hello.
Nitin sir is back.
Yes, Dr. Nathan, can you hear us?
Should
Dr.
I should
Nathan,
I
yes, it would be great if you can answer.
Right. So see, like any other cancer, blood cancer is a type of cancer. So simply it means sort of uncontrolled growth of blood forming cells. They can be white cells and etc. There are different types of cancers, and it does differ from other broader variety, which is otherwise called as solid tumors. So blood cancer, although liquid tumor is not the proper word to be used, but then solid tumors and blood cancer, two distinct varieties, and they do differ. There are different reasons why somebody would have blood cancer vis-a-vis why somebody will have non blood category cancer like solid tumors. There are differences in the ways we treat. For example, for solid tumors, for example, for breast cancers, they would use surgery, and then they would be using different modalities of treatment during treatment. But then in blood cancers, most of the blood cancers are treated with chemotherapy, immunotherapy. So there are various differences when it comes to differentiating between blood cancers and solid tumors.
Thank you so much, Dr. Vinay, for explaining that to us and to all our audience. Moving on to my next question to Dr. Manoj. Dr. Manoj, can you answer what are the early signs and symptoms of blood cancer, such as leukemia, lymphoma, and myeloma? How can individual differentiate these from other common ailments?
Yeah, this is very important question, Simi. And at the outset, I would like to thank Pfizer for organizing this thing, which can guide general public for the awareness of blood-related problems and particularly blood cancer. Many times, when a patient of blood cancer comes, the relatives, the other people do ask, what are the initial signs which should warn someone who has blood cancer. Usually, blood cancer uh, happens to some individual. That means what happens? His or her blood cells goes here, there, everywhere. His hemoglobin goes down, and because of hemoglobin being low, he starts feeling low, tired, fatigue, shortness of breath. All those symptoms associated with loss of oxygen or low oxygen start to happen. Once the WBCs are also low, they start feeling recurrent infections. If wounds are not healing properly, some neutrophilic issue, the blood cell issue might be there, and that can be the early sign of blood cancer. And third important cell in our blood is platelets. When platelets are low, they help in blood clotting. So when platelets are low, they start developing some petechial, ecchymotic, red colored lesions somewhere on the skin, in the mouth, or some type of bleeding somewhere. You can understand these are the symptoms which can be seen in other illnesses as well, where you feel tired, fatigue, bony pain, body ache. So you should not be thinking straight away to the blood cancer, because these are common symptoms. But rather than waiting for things to happen, if you have any symptoms related with the blood cell like tiredness, wound healing is not proper, or you have some petechial ecchymotic lesions, better to get the blood test done. If your initial blood test is not proper, then maybe early you can take the consultation of hematologist who can guide you. One more type of blood cancer is lymphoma, where you have lymph nodes enlarged. Lymph node means some tiny tumors will be there at particular sites like neck, maybe axilla, maybe inside the chest, in groin area. Many times they get confused with the rubbery lesions, which are usually fat lesions. But rubbery lesions which are non-fatty are actually the lymph node. So if you feel that some lymph node is there which is non-tender, non-painful, rather than directly jumping on blood cancer, you can see your physician or your nearest doctor. If he or she feels that this looks like something as a red flag, maybe early consultation of hematologist is needed. One more type of blood cancer is myeloma. In that, usually bony disease is there. So if lower back pain is there, chronic low back pain is there, rather than wasting time, maybe you can see a physician, nearby doctor, and if he or she feels that there is something alarming, maybe hematology consultation can be sought. So to summarize, blood cancer doesn't have specific symptoms or signs. These are general signs only, but depending upon the severity, depending upon the age, depending on the specific characteristic, we can guide them after doing the blood test or some more test whether he or she has blood cancer or not. That's all. Thank you.
Thank you so much, Dr. Manoj, for explaining that question to us and to all our audience in a layman language so that everyone out there can understand this and the importance of this. Moving on to risk factors with Dr. Nitin Gupta. So, can you explain us, are there specific risk factors, genetic, environmental, or lifestyle related, that increases the likelihood of developing blood cancer? So, how can people assess their risk?
So again, first of all, my sincere thanks to Simran, you and Pfizer for this great initiative for general public. And sorry from my side. So I was there was some network problem from my side. I think I was not able to connect properly. Um, I believe I am audible now.
Yes, sir, you're audible, but
Thank
it
you so
seems
much.
the video is stuck somewhere, so we cannot see you.
Okay. Anyway, so it is going from my side, but I think there is
But
some.
your voice is very clear, sir.
Anyway,
You can
so
go
the
ahead.
question here is, yeah. So the question here is the risk factors. So the for many solid cancers like lung cancers and throat cancers, we know there are certain risk factors.
So
Actually,
you're on mute. Yes, yes. We can hear you. We can hear you now.
so the coming to the risk factor in the blood cancers, we don't know them very well, but yes, in many most of the cases we don't find any kind of lifestyle habit which predisposes them to blood cancer development. Um, these are there is some genetic tendency of course that some kind of cancers are particularly common in certain there's an increased risk in certain families, but most of the time the risk is little bit higher than the general population, but it is not that it is a genetic disease as such. Coming to uh, other things which can predispose to blood cancer is say for leukemias, uh, some type of leukemias we see in a particular age group, like in elderly people after the age of 60, 70 years, we see some type of leukemias or myeloma type of disease, or myelodysplastic syndrome is another type of a cancer. In childhood we see most of lymphoblastic type of leukemias. So there are some variation among the type of cancer between among different populations, age groups as well. Uh, some patients who get say chemotherapy or radiotherapy for other type of cancers, so again they are very much prone to develop a second type of cancer, so which we call therapy related secondary neoplasm, or blood cancers can also develop in those categories. So जैसे किसी को मान लीजिए पहले ब्रेस्ट के लिए या किसी के लिए लंग के लिए रेडियोथेरेपी कीमोथेरेपी हुआ, तो लेटर ऑन उनका चांसेस ब्लड कैंसर डेवलपमेंट का भी इंक्रीज हो जाता है. सो रेडिएशन इज वन ऑफ द कॉमन सी एंड but yes, most of the time when we see uh, population without these risk factors, we still see a lot of cancers. So we don't know why they happen.
Thank you, Dr. Nitin, for explaining that to us and giving us a good example of that also. Moving on to my next segment of the questions, that is diagnosis and early detection. So we know how important is the early detection. To Dr. Rahul, I would like to ask how important is early detection in the treatment of blood cancers, and what impact does early diagnosis have on patient outcomes and survival rates?
Well, frankly speaking, carrying forward the things which Dr. Manoj Toshniwal said, that it is basically the clinical features which decide which side the patient has to go. Now, there are no tests by which we can determine whether this patient in future will get leukemia or lymphoma, or that for that matter myeloma. It is just we have to make the people aware of the signs and the symptoms with which they go to the physician, and ultimately the people come to us. Basically, we divide our leukemias and lymphomas, speaking in the layman language, in the acute form and the chronic form. Acute form, they come very early with the symptoms, and chronic forms, they are sometimes not even detected lifelong. Only when the patients are doing their routine workup, we see some reports where we find some leukemias like the chronic myeloid leukemia or the chronic lymphocytic leukemia. They are incidentally diagnosed. So, as such, there are no methods by which we can detect these things early.
But they must can have an impact if diagnosed at an early stage. So what difference does it
So
create in that case?
basically, in leukemias, we don't have the staging system. We have the
Okay.
staging system in lymphomas and myelomas also. So leukemias, there is no stage, so we cannot detect them early. Lymphomas, yes, if the patient feels that there is some lump in the chest or the neck or the axilla, maybe in the groin region, and some like we Indian population, we think that okay, there is some lump, we'll see it later, it is not harming us. So this is the case when we have to explain our patients that even a single lump in the body can be any form of lymphoma, and if detected early, they can be treated in a better way.
Thank you, Dr. Rahul, for answering that. Moving on to my next question, that is challenges in diagnosis. So this question would be to Dr. Nitin Gupta. So what are the common challenges or obstacles faced in diagnosing blood cancer at an early stage, and what can be done to improve this early detection?
Again, as Dr. Rahul Rattan said, um, early detection of blood cancer is quite tricky, because different types of cancer can present in different ways. So, like acute leukemias are there, so they are kind of aggressive diseases. So those are even they make us sick very fast and even lethal in a short span of time. While the chronic leukemias, they are incidentally detected many of the time. So patient comes with a report that they did for something else, and they found their blood values are not right, and we diagnose them with a chronic type of leukemia. So these things happen. Um, Nowadays, coming to the challenges in early detection, only thing is, I can think most of the time the diagnosis is quite simple, compared to the other malignancies. Doing a simple blood test or complete hemogram or a complete blood count can give a fair amount of picture about the likely diagnosis of leukemia, a type of disease we are facing. Then we do some sophisticated tests like a bone marrow testing.
Hmm.
Our blood is formed in the bone marrow, so bone marrow resides in our bones. So for making a proper diagnosis of leukemia, most of the time we need to do a bone marrow testing, in which we put a needle in our backside of our hip bone, which is a simple test, takes only 10-15 minutes, and done under local anesthesia. We don't make the patient unconscious by giving general anesthesia. It is just by doing a local anesthesia, we put a needle in the bone and take out a sample, send for the laboratory testing. There are multiple type of testings are there in the most of good hospitals. These are in-house facilities available for conducting those tests, and sometimes if they are not available in a particular hospital, they have facilities or tie-ups with the bigger hospitals or bigger laboratories, so they send their samples there also for making a proper diagnosis. So I think whenever we find our blood values are not good, we don't need to sit upon them or do some kind of home remedies. Better to go to a hematologist or your physician and oncologist, show them your report, and of course, if they ask you to do bone marrow testing or some other testing, so better to do it to make a proper diagnosis. It is not that if somebody has a leukemia they are going to die. So as previous my colleague said, treatments can be done, and most of the time we are able to cure those diseases. So I think that will be discussed later also. So we need to do simple CBC testing and just carry forward that.
Thank you so much, Dr. Nitin, for explaining that. As it is very important for all the listeners out there, people out there, to understand how important this is to get this diagnosed, or get this detected at an early stage. Moving on to my next question to Dr. Manoj Toshniwal on diagnostic techniques. As most of the things or a similar thing has been explained by Dr. Nitin Gupta, but I would like to ask from you also, Dr. Manoj, what are the most advanced diagnostic tools available today for detecting blood cancers? So, how do methods like blood test, bone marrow biopsies, and imaging contribute to accurate diagnosis?
Yeah, very important, Simi, this question. As you already told that most of the things already have been covered by Dr. Nitin sir and Dr. Rahul very well. I'll just straight away say, as I say to all my patients, nowadays everyone says that the incidence of these type of malignancies, various cancers, is growing.
Hmm.
But I
Yes.
tell them that daily I diagnose at least 4 or 5 patients of leukemia, but I see at least 8 10 patients of leukemia who are cured. So yes, there are new methods which can diagnose these diseases early, but we have many new methods which can prognosticate them very well. Prognosticate means we can guide the therapy as per the individual need. There are various markers in our blood which can give us the exact idea how the malignancy will behave, what are the points where we can target so that patient can be cured. These are called as targeted medicines, targeted chemotherapy or immunotherapy. And this happens because of the various blood tests which are available, like cytogenetics, fluorescent in situ hybridization, that is FISH, Some tests are like PCR, where molecular markers can be tested. Next generation sequencing, where we can take mapping of that particular cancer cells, where we can see what genetic code break has happened and due to which the cell has come into the malignant potential. We can target that particular thing and cure them. So because of these various tests, though diseases have become expensive to diagnose and treat, but yes, cure rate has gone exceptionally well because of these blood tests. So there is no single test which can diagnose or prognosticate, but there are battery of tests depending upon your individual need for hematology. The treating doctor will decide whether you will need PET scan or not, whether you will need NGS or not, whether you will need fish, and how to act on those tests. So these tests are not only for diagnosis but also for the prognostication and to decide treatment as well. Thank you.
Thank you, Dr. Manoj, for letting us know about that and to the point. Moving on to the treatment options and innovation from Dr. Vinay Kumar. So, Dr. Vinay, can you explain what are the primary treatment modalities currently available for blood cancers and how do they vary between different types like leukemia, lymphoma, and myeloma?
Right. So Simran, when it comes to talking about treatments which are used for blood cancers, we all know that there are various types of blood cancers such as leukemia, lymphoma, myelodysplastic syndrome, and then etc. And then we cannot generalize the treatment of blood cancer as such in one statement because there are various types. For example, in leukemias, there are various subtypes such as acute and chronic. For chronic leukemias, such as chronic myeloid leukemia, we've been using targeted drugs, which Dr. Manoj has already talked about. And then there are other types such as acute leukemias where there is no other treatment but the chemotherapy. There are various chemotherapy regimen which are used, and these are standard treatment which are format and regimen based, and they are followed worldwide. So generalizing all this, for most of the blood cancers, the treatment started with chemotherapy, but now in 2024 we are in the era of targeted treatment and immunotherapies. So some chemotherapies are being replaced by immunotherapies because they have lesser side effects. The response rates and the cure rates are better with immunotherapies because simply they are attacking the particular target in that particular cancer cell. So chemotherapy, immunotherapy. Rarely we would use another treatment such as radiotherapy in patients who have say lesions which are obstructing any, or which are pressing on any particular vital body organ. But chemotherapy, immunotherapy, rarely radiation therapy, and then bone marrow transplants for some blood cancers which are not getting better with chemotherapy, or which have recurred or have come back after chemotherapy. There we would be using bone marrow transplants. And now further newer treatment modalities such as CAR T cell therapy and etc. are being used for some particular uh, sort of resistant types of cancers where chemo and transplants have failed or they have not worked well.
Thank you, Dr. Vinay, for explaining that. And it is very crucial to understand all those primary treatment options available at this point of time and to be aware of this. In case anyone, we just hope and that no one is suffering from this, or anyone around them is not suffering from this. But these are kind of a very crucial information which now everyone should be aware of. But moving on to the innovative therapies, which Dr. Vinay also mentioned to Dr. Rahul. So, Dr. Rahul, I would like to know what are some of the latest advancements in blood cancer treatments, such as CAR T cell therapy, immunotherapy, and targeted therapies, and how are these innovations changing the landscape of treatment?
Yeah, carrying forward the discussion, as Dr. Bohra said, we have the latest innovations like the CAR T therapy, immunotherapies, and basically the CAR T in our body, whenever there is some, maybe you can say any infection, or maybe the patient has got the cancer, There are lymphocytes in our body. Now we have the B lymphocytes and the T lymphocytes. Now T lymphocytes, they basically attack the cancer cells. But cancer cells have got various mechanisms by which they overcome this defense mechanism. So basically, CAR T cell therapy is like we are uh, forcing the body's T cell only to act against those cancer cells, but in a genetically modified way. Well, these are the newer techniques. Personally, I don't have any exposure regarding the use of CAR T cell therapy, and it's a very costly therapy also. Maybe they are using in the European countries or the American countries. Personally, I don't have any exposure of these things. Regarding the immunotherapies and the targeted therapies, yes, they are now the frontline part of the chemotherapy. We use along with chemotherapy to achieve the better cure rates in lymphomas and myelomas also. And targeted therapies are used in acute leukemias also, mostly in the relapsed and the refractory setting, where they have made the chances of survival better in the patients.
Thank you so much, Dr. Rahul, for answering that question. I would request all the speakers to please switch on your videos as we are live and our audience would like to see our all the speakers out there. So my next question is to Dr. Nitin Gupta regarding the role of precision medicine, or we call as personalized medicine. So how is personalized medicine shaping the treatment of blood cancers? Can you provide examples of how treatments are being customized based on patient's genetic or molecular profiling?
So I think blood. Very good question again. We are going in 2024 in this era. We are going towards precision medicine, and blood cancer is not an exception. So I think there are many type of cancer where we are at least deciding their not only treatment. Of course, ultimate aim is to give them proper treatment based upon their genetic profile or tumor profile. But yes, at least as of now, what we are doing is we are better able to discriminate their behavior. So whether that particular patient is going to respond to a particular type of treatment we are giving, or they are not going to respond, they will need another kind of therapy like a bone marrow transplant or so and so. So use is very much on. But yes, ultimate goal is to give a directed treatment. So I think Dr. Rahul and Dr. Vinay already discussed part of it. Um, uh, like a disease is one type of chronic leukemia is a chronic lymphocytic leukemia. So where we do some genetic testing and to decide whether they will given a chemotherapy type of medicine, or we better give them a targeted therapy. Similarly, in chronic myeloid leukemia, particular target, and normally all the patients are being treated with a particular kind of medicines, so they are responding well. Similarly, in some kind of cancers like myelofibrosis is one of them. So when we find some particular type of genetic mutations in their cancer cell, so we better direct them to a bone marrow transplant rather than treating them with a targeted therapy. So I think both the things are happening. We are better able to differentiate between patients in a particular disease category. Not all the AML patients are same. Not all the CML patients are same. So there are subtle differences which we are now better able to understand, and our understanding is getting better with time, and so we can better decide their future treatment plan. Just part as Dr. Rahul was discussing the CAR T cell, we are all learning in the phase. It is a new therapy in India. Some of us have used in couple of patients, but yes, so I think there is some network issue. So Indian CAR T has come available. So the use will increase, and it is also a type of a personalized therapy.
Thank you so much, Dr. Nitin. Can you give us few examples of how treatments are being customized, or the difference the difference is there when a person is, being given as a precision medicine treating by this molecular profile, and the other patient who were treated with the basic or the immunotherapies and other kind of therapies?
Right. So, say if a patient has a say we are talk of a lymphoma, so one type of lymphoma is uh, B cell lymphoma. So these cancer cells normally express CD20. So we have treatment to target CD20. We target them. Similarly, some T cell lymphomas are there, so they have CD30 expression on their cells. So we have treatment with immunotherapy to target CD30 as well. Hodgkin's lymphoma, and those are very successful treatments. So patients are living longer and even many of them are being cured with these treatments. And once they nowadays with the availability of these treatment, patients are living longer and even many of them are being cured with these treatments.
Thank you so much, Dr. Nitin, for giving us that example. Moving on to my next question to Dr. Manoj. Dr. Manoj, managing treatment side effects is one of the very important and difficult aspect for the patients, and then as well as for the doctors to, give them that motivation and, to be positive about the treatments they're receiving, so that their body receives it well, and then it actually helps in recovering. So, what are the most common side effects of blood cancer treatments like chemotherapy and radiation therapy has, and how can patients manage these side effects to maintain a better quality of life during the treatment?
So this is actually one of the most important concern whenever someone gets diagnosis of blood cancer comes forward. They start with like, I will not go for chemotherapy because of this inherent tendency to think that it is very, very, very difficult. And this all of us have been thinking since years. First myth is to break, blood cancer is going to happen to someone someday. That doesn't mean that it's something bad has happened. Why do we want to be very sympathetic with that particular person? You can have appendicitis, you can have hair transplant done, you can have some other illness. It is one type of illness which is going to happen to you. There is treatment and you will get out of it. You have to start the treatment. That's all, first thing. Second thing, yes, initially side effects were significant with the chemotherapy, but with advent of newer medicines and the drugs which can lesser down the side effects of chemotherapy, now things are changed significantly. They can tolerate chemotherapy very well. There are many medicines which can be given only in pill forms. There are many medicines which can be given only in daycare. There are many medicines which can be given just once in a month. They don't even cause hair loss. So why the hell everyone is thinking chemotherapy means bad? Chemotherapy means nothing bad. Chemotherapy means some medicine which helps to kill the cells. Killing the cell is chemotherapy. That doesn't mean that it is bad. You just have to break that myth, and whatever the side effects are there, your hematologist, whoever is prescribing you, will guide you initially only. That with this medicine, you may feel some nauseated, you may have some hair loss, you may have some change in your skin color, you may have some rash on your body, but these are manageable and these are the way to manage. If you don't treat, what will happen? That also should be asked. If we don't treat, patient will die. But if you treat, yes, it is highly curable disease. You take those pills, you take those medicines, you take that chemotherapy, and with manageable side effect, which we can initially presume and act on that, you will be out of the woods for sure. That has to be given to the patient in first counseling only, also to the close relative, because they are the one who are already worried. Now he will start feeling nauseated, now he will start feeling hair loss, he will start feeling that. That will not happen if you are already counseling them in right way. So yes, there are side effects, but they are manageable nowadays. And with day by day coming new immunological markers, new targeted therapies, side effects have significantly came down on the part of chemotherapy for sure. That's all. Thank you.
Thank you, Dr. Manoj. My follow-up question on that, is it advised by the doctors to exercise or go to gym or any kind of exercise to the patient, to the blood cancer patient who is suffering or going under the treatments, as maybe it can elevate their mood, or it can help in in the treatment plans? Dr. Manoj?
Came for the Vinay. So yes, we do advise them to be active. Whenever we are giving some chemotherapy, there are drugs which are like some steroids, which can make your muscles weak, which can make you feel low. So yes, being active is good thing, but not enthusiastically active to the extent that you may bleed. Because with blood malignancies, there are points where your counts will be low. There are points where you will be having thrombocytopenia with significantly low platelet count. There are points where will be neutrophils will be very low, so you avoid the infection. So yes, be active, but still try to avoid infection. That is what we prescribe to them. Also, to keep yourself busy rather than being just thinking about that particular disease, be engaged in some positive activities like reading something, doing something which you wanted to do since years, but now God has given you chance. That 6 months you pause, during that time you can utilize that time for the betterment of yourself. Once you are out of this malignancy, you can utilize that time so that you can have better in your better opportunities in your career, in your business, in your family time, everything. So yes, that positive counseling is always needed. We always do with them, and many of them do follow, and that surely helps them to get out of the disease as early as possible with less side effects.
Thank you so much, Dr. Manoj, for answering the follow-up question on this. Moving on to the next question from Dr. Vinay. Dr. Vinay, can you? We know that the importance of support system at the treatment duration which we are going, or when the person is diagnosed with this blood cancer, which the news when it comes, it feels very. It feels it hurts a lot to the person and to the family going through this. So how crucial are support systems such as family mental health counseling and patient communities in the blood cancer patient's journey, and what role do these support networks play in recovery and emotional well-being?
So extremely important. In fact, I would say as important as the treatment, chemotherapy or etc., whatever it is. So the support system is very important. Now, see, you've talked about that sort of emotional turmoil when somebody is diagnosed with blood cancer. So that is more so when somebody is in that particular age when they understand. So we treat patients who are into pediatric age group. Say somebody is like 3 years, 4 years old, so there that trauma is more for parents. The child doesn't understand what is happening with him or her. But when somebody is say 15, 16, or maybe 18, and then they understand everything, they'll go back, they'll Google. So it's a severe impact when they are diagnosed with a particular type of blood cancer. So that time family will help that particular person. When they start their treatment, of course family is always there with the patient. But then there are social support groups, there are patient groups, there are myeloma support groups. So these groups are formed by patient themselves, especially those who are into treatment or those who are cured or are into remission. They have been having disease free life. Though these patients, they usually come forward and they form a group where the other members who would be given free access to the information. These patients have a lot of queries. There are some queries and doubts which are cleared by doctors like us who are treating them, but there are few queries which are only answered in a better way by a particular person who has gone through this. So patient support group are there, and they're very very important, because there are cases where during treatment patients face abandonment. Patients would stop treatment because of so many reasons. social reasons, financial reasons, and then mental stress. So it goes without saying that a particular patient will have better outcome with their treatment if they are mentally well supported, emotionally well supported. That support will come from their family, friends, near and dear ones, and of course these patient support groups. And unlike West, probably 20 years ago, we did not have this concept of patient support group, which started with the Western countries. But now we can proudly say that we have, all over the country, we have myeloma, lymphoma patient support group. They have their annual meetings, they have their semi-annual meetings, they have their webinars, like we are having this webinar. They have their webinars every 15 days, and a lot of information and support is disseminated through these support groups. So very important.
And you said it right, Dr. Vinay, that this kind of support groups actually helps a lot to raise awareness, to reach out to that part of the public, and to help the government or actually the authorities who needs that kind of funds, that kind of support, or any kind of treatment help to them. Because with the earlier when they were not there, and you said in the West it started first, and then it helps in raising awareness. It helps in actually reaching out to the families, to the patient who actually needs all those kind of supports. And through this webinars, through this virtual sessions, or the meeting, monthly meetings, or anything they do, it actually helps to understand this kind of diseases better, and to raise awareness, and to make sure to the public out there, they are not alone in this fight. People are there for them to support. And I think that support gives them other another level of motivation to fight for this.
In fact, I miss saying that there are, various crowdfunding platforms where the support group would help someone who is probably financially not capable getting treated, and they will, help them getting enrolled into those crowdfunding platforms. And there are cases which I have seen where patients who were not financially capable actually got their chemotherapies and got transplanted entirely through support group because they were shown the right way.
Yes, yes, you said it right, Dr. Vinay. Thank you so much for sharing your insights on that. Moving on to Dr. Rahul on preventive measures. So, are there any preventive measures or lifestyle changes that individual can adopt to, reduce the risk of developing blood cancer, particularly for those who has a family history of this disease?
Well, you used the wrong word, family history. No, the leukemias and lymphomas and myelomas, they don't run in families. First thing, let's be very clear about this. These are all sporadic diseases. Sporadic means these are individualistic, not running in the families. One thing. Next thing, there is no clear cut like possible causes that this can cause leukemias. It can happen anytime. We just correlate these things with smoking, alcohol, pesticides, insecticides. But we are all exposed to all such things. You know that Delhi pollution is more harmful than smoking. So we cannot correlate that the people living in Delhi will have more of leukemias and lymphomas compared to that living in Shimla. So as such, definitely yes, the lifestyle habits should be changed. Smoking as far as possible should be avoided. Alcohol should be avoided. Now the people working in the pesticide industry, insecticide industry, they have to earn their livelihood. We cannot say them "Ki just don't work with those industries. So it is difficult to say what all things are causing these things. Definitely lifestyle changes which can be curbed, like this overweight and all these things, the junk foods, which we usually correlate that these things causes these things, but nothing can be done as such.
Thank you so much, Dr. Rahul, for giving us that clear-cut answer that there is nothing specific on that. If we, and yes, I think we relate all these factors to all the diseases or the lifestyle diseases we are, hearing of nowadays. So I think if there is something to be happen, it will happen to anyone at any point of time, and it's just that we have to take it in a fighting spirit, that anything can be curable with the medical advances we have as of now in today's time. Moving on to my next question on public awareness campaigns from Dr. Nitin. Dr. Nitin, how can public health campaigns be more effective in raising awareness about blood cancers? And what strategies should be employed to encourage the early screening and timely diagnosis in the public?
So yes, Simran. So carrying forward Dr. Rahul's view, again, we don't have many blood cancer don't have many identifiable causes behind them, and so we don't know how to prevent them. It is all about somebody's bad luck, I we would say.
Dr. Nitin, you're not audible to us, I think.
Very much compatible with the normal lifespan. Similarly, okay, so there is some. Am I
We can
audible
we
now?
can we can hear you now. Yes. Yes.
Am I audible?
Yes, yes, Dr. Nitin,
Okay.
you're audible now.
So yeah, we need to increase the awareness among public, because once somebody gets a diagnosis of leukemia, they think, oh, the life is done now. Uh, they will die soon and nothing can be done. But this is wrong. We need to increase the awareness. Many of the chronic leukemias, they don't even require treatment, and patients are too much stressed about their diagnosis. They do repeat their blood tests every other day, like in a patient of chronic lymphocystic leukemia, which is not advisable. So there is a lot need to be done to increase the awareness. Many of the chronic leukemias, they don't even require treatment, and patients are too much stressed about their diagnosis. They do repeat their blood tests every other day or so and so, and they keep so there is a lot need to be done to increase the awareness. And now not every patient is our kind of tech savvy or Google friendly.
Dr. Nitin, I think we lost your connection here because we cannot hear you now.
Hello.
Yes, yes, you're audible again.
I think there is a problem. I just uh, if you allow, I switch my camera off.
That's fine, Dr. Nitin. That's fine.
I think the
Sure.
bandwidth is a problem here. So am I audible
Yes.
now?
Yes, you're very clearly audible now.
That is good. So I think we need to increase the awareness, which is very much needed. And as Dr. Vinay said, that patient support group are doing a great thing in this regard. People are need to be connected to the respective groups like myeloma or lymphoma or a CML group, so which are quite updated, and patient can share their experiences, can share their stresses as well. So and see if somebody is doing good, so they can get even encouragement from the same. And then there is multiple platforms like crowdfunding platforms, etc., available, so somebody in need can raise money from them as for their treatment. For acute leukemias, again, not each leukemia is deadly. We need to increase the awareness, and these kind of meetings are very will be very helpful, I can see, for general public, because uh, we we can discuss the treatment, and they need to realize that not every leukemia is deadly. Somebody will be cured with a simple pill, will like a targeted therapy in a chronic myeloid leukemia, and somebody will be treated with more intensive treatment and may require a bone marrow transplant or so and so, or CAR T cell therapy. But yes, there are so many options available, and we are able to we have made a good progress in last maybe 20-30 years. The treatment paradigm of leukemias has changed a lot. So earlier we used to say patient that there is no treatment available for you, just um, uh, take a supportive treatment kind of thing. But nowadays we are treating elderly people and people with many comorbidities with success. So there is a lot need to be done, and I think these virtual meetings are is a good source of creating awareness among public.
Thank you, Dr.
Thank you.
Nitin, for answering that, and giving us that importance on this topic and how we all can work together in this part. Moving on to the future directions and research with Dr. Manoj. Dr. Manoj, what are the most exciting and promising areas of research in the field of blood cancer today, and how close we are to finding a cure or achieving more effective long-term management of the disease?
This is, I think, question for everyone who thinks that yes, we are moving fast forward in treating these blood disorders. Diagnostic wise, we have come a very long way because we can diagnose these disorders to the extent that what molecular marker has gone wrong, and because of that, the patient has developed the disease. And with that knowing, now we have got these treatments like CAR T cell therapy, that is chimeric antigen receptor T cells. In this discussion, already this has already came, but just to understand to the general public, these are the cells which are genetically modifiable. In everyone's body, daily some or the other mutation keep on coming and going, but our body's police or the surveillance system is something which works to throw that garbage or repair those cells. Someone develops malignancy, one theory is that that garbage is of bigger amount, or our police system is not able to clear that out. So we take those police out, train them how to treat that particular problem, and again reinfuse them into the body so that that particular thing can be repaired. And believe me, these things are now in the community, where in western world, in China, they are routinely using CAR T cell therapy for patients who have relapsed refractory disorder, which was initially thought to be the death sentence. It is way better than the bone marrow transplant as well. Someone should not take that these are the therapies which will be needed to every patient. No, that is not for every patient. Most of the patients are still getting cured with simple tablets, some doses of chemotherapy, and they are out of the woods. Some of them do need some bone marrow transplant, which is also available in the tier 3 countries as well. But some which are initially thought to be incurable by their genetical profile and with genetical modifications, we do have CAR T cell therapy or the gene therapy thing, which can go inside the body and cure whatever the problem has happened. So yes, up till now we have gone very good into the newer treatment modalities, newer diagnostic modalities, and in next 5-10 years things will be way better for sure. So we should be thankful to all the people who are working relentlessly to make life of these blood cancer patients better, making these disorders curable, making them completely normal even after happening such type of incidents in the body. And maybe in next decade things will be way better for sure. Thank you.
Definitely, Dr. Manoj, things will be better and are in better condition as compared to the previous times, where now we have better advancements, new technologies, where treating patients with these kind of diseases is still better, and we still have more and many options available to this as compared to earlier times. And I think all the researchers and the doctors who are working into the field and relentlessly working to make sure that each and every patient out there is cured and is living a healthy, happy life. And all this credit goes to doctors and the researchers and the team behind, which we do not see much. But yes, it is without their support, it could not be possible. So thank you for being one of those doctors who are working to treat their patient day and night. Moving on to my next question, that is the role of clinical trials, to Dr. Vinay. How do clinical trials contribute to the development of new treatment for blood cancer? And what should patients and their family know about the potential benefits and risk of participating in clinical trials?
So see, clinical trials are backbone of any development of treatment regimen, because any drug which is coming into clinical practice has to go through rigorous clinical trials, phase 1, phase 2, phase 3, various types of them. And especially in blood cancers, for that matter, any cancer, any disease. And in a country like India, where good number of patients would have financial issues, uh, these patients would get benefited with the clinical trials, because they give that opportunity to get enrolled into a trial for those patients who otherwise will not afford that drug. That is number one. And when the drug is not immediately available in our country, so these newer drugs can be offered to these patients when these patients would need it. So potential, there is immense benefit for those particular group of patients where they have where the disease is sort of come back, or disease is resistant to the offered treatment, and they are waiting for the new treatment. And when these patients get enrolled into these trials, definitely they would get benefited.
Thank you so much, Dr. Vinay, for answering that. Moving on to my last question from Dr. Rahul. Dr. Rahul, advice for newly diagnosed patient, because whenever patient hears that he or she is diagnosed with blood cancer, it becomes very difficult to digest and to accept this news that okay, this has happened, which is unacceptable news for them. So for individual who has just been diagnosed with blood cancer, what would you advise them in terms of navigating the early stages of their diagnosis and treatment options available?
Well, everything depends what is the diagnosis. First of all, we have to tell our patients that don't panic.
Yes.
That is the main thing which we have to tell, because people generally they don't accept that they have got cancer. They are afraid of the word cancer. मेरे को कैंसर हो गया, अब मैं नहीं बचूंगा, हो गया, खत्म. The next thing what comes to their mind is कि सर ये मेरे फैमिली में तो नहीं होगा, आगे तो नहीं चलेगा, अगर मैं मर गया मेरे बच्चों को तो नहीं हो जाएगा. So these are the common questions which people ask in the OPDs. We have to clear these questions first. Next, regarding the treatment part, of course, it all depends on what is the stage of the cancer, what are the risks of the cancers. That we have to explain anyhow to the patient. But the common question needs to be answered first. That is the thing.
Thank you so much, Dr. Rahul. Dr. Nitin, last question, or I should say, a closing message to the public. What is one of the key message you would like to leave with the general public regarding blood cancer awareness and the importance of early detection and treatment to all the listeners out there?
As Dr. Rahul said, whenever somebody is newly diagnosed with leukemia, they don't need not to worry too much about it. Go to meet a hematologist, oncologist, and they will guide you for proper treatment. And many of time they will be surprised that the stress they were taking was not necessary, and only a simple pill can cure them, or many of them will not treatment. So not every cancer is deadly. We need to um, make them understand this thing, which is very much needed. And of course, these are not inherited or genetic disease most of the time, so need not to worry about their blood count. Can give a fair bit of idea about their likely problem. Not every low hemoglobin problem is leukemia, or not every low platelet count is a problem is of a leukemia. Most of the time, maybe more than 90% of time, these are due to maybe some simple iron deficiency or vitamin deficiency, or even some autoimmune diseases. So need not to worry too much about that. They should they need to consult a proper doctor, and then maybe follow their instructions, and most of them will be cured. And the outcome of leukemia has improved so much in the past. In our short lifespan, we see the treatment of leukemia or different type of cancer has changed drastically in last 10-15 years, and we can imagine what will happen in coming 10 to 15 years. So the treatment protocol we are using today, we may not be using in those future, and the outcome of those patients will be much better, which is far more better. So I think that should be the message. Thank you.
Thank you so much, Dr. Nitin, for giving us that closing message. And you said it right. All the cancers are not deadly, but it has, made up in a mind that the word cancer sounds deadly and dangerous, but there's many and, a wider hope that or cancers can be recovered because of the advancements and the treatment options available as of now. And the credit goes to, like I said earlier, to the researchers and to all our doctors out there who are working tirelessly to treat and cure all their patients out there, because no one wants to see anybody in that condition. And yes, we are getting closer, we are getting stronger to treat our patients to come out of those kind of deadly diseases, and we are getting cured by the doctors with the help of the new advancements and the treatment options available. And thank you so much to all the participants, panelists present here for coming to this platform and helping us to raise the awareness around blood cancer, lighted red, for this special occasion, the special month which is dedicated for blood cancer, because your insights and expertise matters a lot to raise this awareness. Thank you so much to all.
Thank you. Thank you so
Very much,
much.
sir.
Thank you,
Thank you.
Pfizer. Thank you, Semi. Thank you, Vinay sir, Nitin sir, and Rahul. Nice to see you.
Thank you very much, sir.
Thank you. Good night.